Hi all, hope each and everyone is doing well and good. And this is me, Dr. Amrita here. See, why am I here today? Because today I'm going to dedicate this video going to be a bumper, very useful video, a bumper lottery. We are going to discuss about the must know questions. And if you study these questions or we are just go with these topics, of course you can definitely win the race and win the battle. And I want to say that if you guys miss any of these topics, it is really going to be hard because so many topics, many of them know that this is going to be very important. And if you are planning to miss any of this simple questions as well as the most famous and most important questions, if you miss it, it will definitely going to affect your rank because most of them will be familiar that this is the most important topics, so they will study very well that topics. And if you miss it, yes, of course your rank will definitely get affected. So to avoid that, this is for all those who guys who have just passed the mbbs and just curiosity what all question is going to come expecting. Here I am doing an investigation to find out the exam questions. Yes, we can definitely raise this battle, and I'm going to put this video in a very short thing, and I hope that you will definitely be use of this because I'm discussing how to learn this medicine easy. If you are planning to start this time and if you're totally confused, yes, I guarantee you definitely these questions will be going to come because these are the very important topics, and it is an easy way to study the subject in a short span of time. Okay, so you all know that I just took a book and a pen. Okay, just this is my quarters actually, so background I think it's okay for you all. Okay, so okay, we all know that how many divisions are there. There is serious CNS, blood, infection, endocrine, kidney. You all know that what is it. So if you're planning to start study medicine, study wisely. I will say that start with the chapter electrolytes. Okay, because every time there will be a question. If you look at last time, the number of questions in electrolytes was pretty less. But when you compare the past years from 2020 onwards, so many questions. Every time there will be a question. So this time also you can definitely hope there will be a question. You can predict that, yes, of course, because this is going to be very important. I just say everything fast because I don't want you to waste your time. Okay, Harrison, there will be a box. Harrison or Davidson, most of the standard books have got a box that you want to study, like metabolic alkalosis, metabolic acidosis. It's a conditions like vomiting, whether it is metabolic acidosis, whether it's metabolic alkalosis, respiratory alkalosis, which comes under. That means hypocalcemia. Is it respiratory alkalosis? Like that. There is a table which contain like examples of like metabolic alkalosis, this many, respiratory alkalosis, this many. Study that table. The first thing you want to do is study that table. Then later the second step is how to find out whether it is acidosis, alkalosis. They will give a case scenario. Like if you are less than means what? It is acidosis. Above it is alkalosis. You'll be known that. So that a wrong thing and all these codes are there. So it's very important. You expect a question will be asking to find out whether it is metabolic acidosis, alkalosis, respiratory. So just study that. So electrolytes, very important. Then after studying that, just do practice some MCQs and previous year questions. Okay, very important in electrolytes. These are the must know topics. If you study this topic plus your notes and add on with other questions, you will definitely clear all medicine questions. I will give you, especially if they are so much hard, one or two, except that you will get most of the questions. So you want to pile up the other knowledges, okay, by adding MCQs. So I will tell the basic things. Okay, so first you want to learn about electrolytes. Then what you want to do is study endocrine. Okay, after studying electrolyte, go with endocrine and renal, because this is the most shortest chapter where you can get maximum number of questions. Okay, so we are starting with endocrinology. So before that, I want to say from where am I reading this? I'm reading this from the official neetpg syllabus. They have got a perfect syllabus, isn't so? So from that, I'm just reading what all is important. Okay. So you all know that standard books for internal medicine is always Harrison, and also people used to read Davidson. Okay, so endocrinology is very important. At the same time, as I told, this is going to be a very short chapter. At the same, most topics are coming. Okay, so very important DK, diabetes ketoacidosis. That wala you must study it. Okay, because last time there was a question with that comma, hyperosmolar comma and decay. It's very important. In pediatrics also there was a question in 2023 regarding that decay wala. That is, yes, that's very important. And also what is important, thyroid, that all those things you can connect with surgery and learn. And here men, that is multiple endocrine neoplasia, very important. You cannot go without learning this. You all know in surgery also you will be learning, see what are the conditions that men 1, men 2, men 3, what are the conditions that you can already learn. So here very important is that prolactinoma, that tumors prolactinoma is very important. Prolactinoma is very important, that disorders of the parathyroid. Here most important you want to look about this hypercalcemia, hypocalcemia, what all things with the ECG. That is the most important thing. If they want to integrate, they will do by like that, like hypercalcemia, that what hyperkalemia, what are the changes in ECG, that I will discuss with CVS also. But just study this Cushing syndrome, that picture itself you will get so many ideas. Very important. Disorders of adrenal gland is also very important. So endocrinology, move with it, because it's going to be very important. At the same time with surgery they can integrate and ask, very important. Endocrinology, study this. Then we'll be moving about nephrology. Yeah, nephrology, you want to look about that Batter syndrome, Gilbert syndrome, Liddle syndrome. How it means, there is a table like what happens with electrolytes in each of the things. Like Liddles, there will be hypertension. Just look at this and go. Okay. Then yeah, this can be that. Yeah, that kidney stones wala, when you analyze the previous 2 years, this questions little bit, but you can expect this time if they can ask. Like in laxates abuse, what all type of crystals, urite stones, true white stone. There is a box in the standard textbook. There is a box and showing all those things. Just learn that box. Very important. Then comes nephritic syndrome and nephrotic syndrome. That's again it will be coming with pediatrics also. They can link and ask. Okay. Then very important when it comes to nephrology, with integrate with pathology wala. So there is minimal change disease, what all things, where this diffuse membrane is thickness. There is also another table is there. Okay, that's learn. If you're looking marrow also, then you can, then pearls, there'll be a box wala, very important. MCD, what all types, that features you are getting now, that is very important. They will link it with pathology and definitely going to ask, very important. The very short chapters are this renal as well as endocrine. So many questions will be asking. Polycystic kidney disease was simple wala. That is what USG, how will you find? There's a criteria more than 3, like that. Just read and go that thing. Yeah, renal tubular acidosis, important. That is acute and chronic, how it is. And also I want to say that urine clearance wala, there is a polydipsia. What happened in polydipsia? There is a very good graph is there. Okay. That diabetes insipidus, central diabetes insipidus, what is a graph, what is the ADH value. There is a one graph, if you learn you can just complete it and go. And this is very important. Liddle syndrome and all I have just explained. Yeah, this is a very important. Then we will be moving to, yeah, blood, what should be said. Blood then means what? It's very simple chapter wala na. Like in pathology you can integrate and learn blood wala, very important. As when multiple myeloma is very important, that hypercalcemia, calcium levels and all those things. Thalassemia, that you can integrate with patho and learn. And that is yeah, polycythemia vera is very important. Where you get PNH wala, that is very important. This with pathology you can easily learn actually. Pathology 6PD, that's all comes in biochemistry. In medicine point of view, very important is multiple myeloma is very important. Platelet disorders, there is a chart is there na. Platelet disorders, what happened for FDP, thromboplastin and all those things, PTT, APTT. Just study that table, it will get so fast. Just finish it out. Then come Yeah. Yeah, about. Yeah, gastrointestinal system is very simple because